Assalamu alaikum. So, well, many times you new young students specifically they ask about angina. First of all, stable angina. About stable angina. First of all, just keep this thing in your mind that unstable angina, acute coronary syndrome, myocardial infarction are very different things from stable angina. While talking about stable angina, what happens is there is a transient myocardial ischemia due to actually decreased oxygen supply or increased workload of the heart. And when we come about the cause, the major cause is atherosclerosis, or you can say the only cause is usually atherosclerosis. While what happens is there are three symptoms in this. Three symptoms, first of all, a constricting tight cardiac pain, which is radiating towards the jaw, the shoulder, and even the opposite side of the chest. And number two, it is precipitated with exertion. And number three, it is relieved with rest or glycerol trinitrate GTN within 5 minutes. And when we come about the classification, if the patient has all of these three features, it is labeled as typical angina. If two features, it is known as atypical angina. If only one feature, it's known as non-anginal chest pain. While non-anginal chest pain, how can we further know is it angina or not? We'll get a 12 lead resting ECG. If there is abnormality, then there is a possibility of angina. If the ECG is normal, then it is labeled as non-anginal chest pain. So how do you investigate? First of all, the routine thing is actually stress testing on a standard treadmill or a bicycle ergometer protocol. ST segment should be depressed for more than or equal to 1 millimeter. While an upsloping ST segment is also indicative, but it is less specific. And if these tests are not, confirmatory or conclusive, then the investigation of choice is CT angiography. Now, how can we treat it? We can increase the oxygen supply, we can decrease the workload. The drugs which increase the oxygen supply and decrease the workload simultaneously, nitrates, glycerol trinitrate, isosorbide dinitrate, calcium channel blockers, verapamil, diltiazem, and those drugs which decrease the demand, beta blockers such as non-selective beta blockers, propranolol, or beta-1 selective atenolol, as well as metoprolol. Then there is another newer drug which is known as ranolazine. It also decreases the sodium current and it decreases the cardiac workload. While there is also some interventional, methods. There are some interventional methods by which we can increase the oxygen supply to the heart tissue, which include neovascularization techniques such as angioplasty, stenting, and the ultimate coronary artery bypass graft. So I guess it's the basic, overview. Thank you so much for your time.